Welcome to Pharmacy Prep, PTCB Mock Exam 6. This mock exam mainly focused on patient safety and quality assurance. So this is the patient safety and quality assurance is one of the major portion of the board exams. And this presentation contains 50 multiple choice questions that are mainly hoping to see those type of questions in the actual practice, actual exams. So let's start. A pharmacy technician made an error while entering a prescription drug. She mistakenly entered levothyroxine instead of levetiracetam. So according to Institute of Medication Practices, these two drugs are classified as. So it's always good strategy before even you look at the option. It is a good idea to try to understand what exactly question is given. So in actual exam, you likely see all the option right away. However, you just focus on the stem of the question and then later look up the answer. Make up your answer in your mind and then look up the options. Then it will be easier to find your answers. So here, these two drugs are look alike and sound alike drugs. Also in short, that is known as LASA drugs. There is a ISMP, which is the Institute for Safe Medication Practices, have the look alike drug names with the recommended Tallman letters. Next, where to find look alike and sound alike drugs reference. Where is a good reference for it? The reference for LASA drugs are all three of them. ISMP has the most list of the drugs, and then also you will find them in FDA, Food and Drug Administration, and obviously there are a few samples in Joint Commission as well. However, primarily you will find in ISMP. So therefore, here all of them are correct answers. So here are some sample of reference, that is the FDA and ISMP list of look-alike drug names, and then also recommended Tallman letters. Next, what is a proper Tallman letter for differentiating two drugs, daunorubicin and doxorubicin? Select one best option. So daunorubicin, doxorubicin, dano have to be Tallman, and that has to be bold and Tallman. Rubicin is same in both drugs, so therefore you do not capitalize them. Only you capitalize and make bold for the one that is different in the two drugs names. Next, all these drugs are on high alert drugs by ISMP except acetyl salicylic acid. There is a high alert drug list according to ISMP. Within this list, the drugs bear heightened risk of causing significant patient harm when they are used in error. So although this doesn't mean they have most common mistakes, however, if error happens, that can result into serious harm to the patient. So those drugs are referred as high alert medications. Also, ISMP has made those recommendations strategies to prevent high alert drugs that include in computer systems have automated alerts whenever you enter this drug in the computer that should prompt you to alert. And then also dispensing process have to be standardized, and also independent double checks and of course, patient education about safety of this drug use. Next, which of the following is a drug dispensing error can cause serious harm to the patient? Novolin GE 3070, which is a insulin. Novolin insulin, which is a combination of insulin. All insulins comes under high alert drugs list. That means the dispensing error can cause serious harm to the patient. Next, a patient's prescription for Humalog insulin was mistakenly filled Humulin insulin. According to ISMP, what is the correct Tallman letters to distinguish these insulin products? Guess the Tallman letter for these two. Correct answer is Humalog and Humulin. Log and lin have to be Tallman. Here are the references for insulins and more other drugs that have given sample of Tallman letters. Next, a prescription for insulin 7U was misinterpreted as 70 units. To avoid this error, do not use U. U is considered as do not use, which is a dangerous abbreviation, or also there are dose designations. So here, U or also IU, both of them can be mistaken. Like U can be mistaken for 0 or 4, or IU can be mistaken for IV or 10. So recommended to use units. Units have to be used instead of U. So for both, recommended to use is units. So avoid using U for insulin, which is comes under as do not use list. Which of the following is practices least likely cause error? Using leading zeros for less than 1. What it means is if it is a less than 1, it is always good idea to use leading zeros. For example, instead of 0.x milligram, recommended to use 0.x milligram. That helps to minimize the error. Where to search for Tallman letters? Means where is the reference? What is a good reference for Tallman letters? ISMP Institute of Safe Medication Practices has a list of Tallman letters. Here are some samples of FDA and ISMP list of look-alike drug names recommended Tallman letters. Next, ISMP stands for Institute for Safe Medication Practices. ISMP evaluates and develops patient safety and quality and risk management activities. So therefore, the primary goal is to develop strategies and gather the information of the medication incidents, errors, and develop strategies to prevent them happening in the future. Also, ISMP publishes dangerous abbreviation list, high alert drugs, LASA drugs, Tallman letters, and drugs that are not crushed and chewed, also published by ISMP. Next, which of the following prescription contains dangerous abbreviation? Warfarin 5 milligram QOD. QOD is every alternate day, and that can be mistaken. QOD can be mistaken for every day or 4 times a day, QID. So therefore, it is comes under do not use abbreviation or dangerous abbreviation list. Next, a pregnant patient was prescribed diclectin, but Dexetil was filled. The patient has been on diacetyl many times in the past. What is a possible contributing factor? This type of error is known as confirmation bias. What exactly confirmation bias happened here is patient in history, patient was taking diacetyl. So pharmacists have those thought that patient is using diacetyl. Even patient brings a new prescription, diclectin, which is sound like diacetyl, and patient pharmacist mistakenly dispense diacetyl instead of diclectin. So that kind of bias is known as confirmation bias occurs. What is a recommended strategy to avoid incident related to confirmation bias? How can we minimize the errors related to confirmation bias? It is recommended to use indications, means what is this used for? This drug is used for on the prescription. If indication is given on the prescription, that helps to minimize that error that cause confirmation bias. So therefore, that is one of the recommendation from ISMP to minimize those confirmation biases. Next, which of the following prescription correctly uses leading and trailing zeros to prevent dosing errors? Levothyroxine 0.125 is the correct method of minimizing errors. There are trailing zeros or leading zeros. This is the leading zeros is adding a zero before dot or before point, whereas avoid using dot after, which is a trailing zeros. No to trailing zeros, yes to leading zeros. This is yes and this is no. How does the use of barcode technology in medication administration helps to prevent the error? This is about administering to patients. It's not about dispensing, not about prescription, it is about administering. So while administering, it helps to give it the medication to correct medication to the patient, correct patient. So by scanning the barcode, you can identify which patient, what medication that is given. So that's the purpose of barcode user technologies. Next, a 45-year-old male patient presents to pharmacy with prescription of naproxen taken every 12 hours, 10 days. Upon reviewing medication history, patient discovered that patient is taking warfarin. What should the pharmacy technician do the next? There's a drug and drug interactions. So basically, as a part of the scope of pharmacist, issues that require pharmacist intervention in drug utilization review. That means assess patient medication profile for potential drug interaction, duplication and contraindication, and appropriate dosing and therapeutic duplication. So after patient verification, if you found any potential drug interactions, it is communicated to pharmacists for further evaluation and make those interventions. So that is our issues that require pharmacist interventions. Next, a prescription for amlodipine was mistakenly entered as amiloride into the computer. So that is a data entry problem, right? Error occurred while entering into the computer. So how do we minimize it? This can be minimized by using drug generic and brand names. So having both name helps to minimize those data entry errors. Next, an order for trazodone was mistakenly processed as a tramadol. According to the ISMP, which of the following practices can help avoid these type of errors? Tallman letterings helps to avoid processing the prescription with the sound like name drugs, look-alike drug names. Next, a 35-year-old female with a history of anaphylaxis to a penicillin presents with a prescription of amoxicillin. What is the appropriate pharmacy technician intervention? Alert pharmacists about patient history of penicillin allergy and update patient medication profile. So, issues that require pharmacist intervention are identifying, such as potential allergies, drug interactions, side effects should be alerted to pharmacists. Yeah, we have a very good strategies for more cases coming up. Stay tuned. Continue watching this video and let's see the next question. 25-year-old female is seeking advice on emergency contraception after unprotected sex 48 hours ago. She has no known allergies or contraindication. What should the pharmacy technician do? Tell the customer that the pharmacist will help them and inform the pharmacist. Next, a pharmacy technician observed that a colleague is not following proper hygiene techniques before compounding sterile products. What is the most appropriate action for the pharmacy technician to take? Report the observation to supervisor or pharmacist immediately. So it comes under negligence. Negligence is working below the standards. So it is all the negligence action can result into harm to the patient. So it is always important to inform pharmacists to minimize those harms. Next, during an inventory check, a pharmacy technician finds an expired medication on the shelf. What should pharmacy technician do with the expired medication? Set aside and report to the pharmacist and follow proper disposal regulations. So expired medication are not allowed to dispense it. It is illegal to dispense them and can result into harm to the patient as well. So there is a one implement first in, first out FIFO system to minimize them. Also remove the expired medication from active stock immediately and store in a designated clearly labeled area and follow state DEA and federal guidelines. Next, a patient called the pharmacy to report that they received wrong medication. Pharmacy technician take the call. What is the first step pharmacy technician should take? Document the incident and report it to pharmacist. A pharmacy technician suspect a medication error occurred but is unsure of the details. What is the most appropriate initial step for pharmacy technician to take? You just suspect that the error happened but you're not sure about it. What do you do? Report the suspicion to pharmacist for further investigations. A pharmacy technician received a shipment of medication and noticed that some of the packaging is damaged. What should the pharmacist technician do? Store damaged packaging separately, inform to the pharmacist for further instruction. So role of pharmacists in handling, receiving, and also managing damaged products. So receiving shipment, inspect incoming shipment with accuracy against purchase order, verify the integrity of the packaging, and identify the damages in case you report the issue immediately and document it, and also separate them, damaged item from the rest of the inventory, and then also communicate with suppliers about this. Next, a pharmacy technician is filling a prescription. Notice that dose prescribed is unusual high for pediatric patient. What is the pharmacy technician action to take? Report the discrepancy to pharmacist for verification. Next, a pharmacy technician is instructed to document a near miss event where an incorrect medication was almost dispensed but caught in time. What should be included in the documentation of a near miss event? A detailed description of event and potential contributing factors. However, you will not mention about the who is responsible for it. Near miss errors are mistakes caught before reaching to the patient, and that require immediately reports to all near miss error to supervising pharmacist. A pharmacy technician noticed that medication vial contains particulate matters and the medication is intended for IV use. What is the most appropriate action for pharmacy technician to take? Mark and store separately. Report the observation to pharmacist immediately. So, contamination in sterile product ensure compliance with the USP 797 to maintain high level of sterility and safety. Next, a patient reports experiencing severe nausea and dizziness after taking a newly prescribed medication. The pharmacist technician received this information. What should technician do? Inform the pharmacist and document adverse effect in patient profile. A prescription intended for hydroxyzine was incorrectly dispensed as hydralazine. So how do you minimize this type of errors? Segregate storage of look alike and sound alike drugs. So that way, this is a dispensing error, means it happened in the pharmacy. So therefore, that required segregation of the products with the sound like names. Next, a pharmacy technician received a report from a patient who experienced severe dizziness, fainting after taking a new medication prescribed by the doctors. What should the pharmacy technician do upon receiving report of possible adverse drug event? Document the patient profile and report incident to pharmacist for further evaluation. So what is exactly adverse drug event means? Adverse drug events are results into injuries from the drug use. This can include can happen in the normal dosages or overdosages, or such as giving a wrong medication, or wrong dosage forms, or routes of administration or drug interactions. Those are all result into adverse drug events. So the types of adverse drug events are medication errors, drug overdosages, therapeutic failures, and also adverse drug reporting should be done to MedWatch of FDA programs. And also internal reporting and near miss reporting also required. Next, a pharmacy technician discovered that patient medication dosage was incorrectly transcribed in the patient electronic health record, leading to an overdose. What is the most appropriate next step? Inform pharmacists immediately to initiate root cause analysis. Root cause analysis is a systematic process to identify cause of the adverse drug events. And that can be done by collecting data and identifying the causes of the errors and also implementing correct proper actions to prevent this happening again. Next, a pharmacy technician is filling prescription, realizes the prescribed dose is much higher than recommended dose. What should pharmacy technician do? Consult the pharmacist about discrepancy before filling the prescription. A pharmacy technician is completing report on near miss event involving wrong medication that was almost dispensed. What is important aspect include in the report? So report should include steps, what steps you have taken to prevent this future errors, and what is the contributing factor for the errors, and also details about the event, how this happened. Those are the things should be included in near miss error reports. Next, a pharmacy technician is asked to complete MedWatch form after a patient report an unexpected side effect from a medication. What information is required on MedWatch form? Detailed description of adverse event, medication name, and also patient details. So the MedWatch is the FDA's program, which is collect the data of medication errors or incidents. And there are two types of reporting, voluntary reporting and also mandatory reporting, which means must report for some situations. Next, a pharmacy technician receives a call from a patient experiencing severe allergic reaction after taking new medication. What should the pharmacy technician do? Instruct patient to call 911 or go to near emergency because serious allergic reactions sometimes can be serious, can be fatal, like anaphylactic reaction, and that happens very quick. So therefore, urgency is important here, them to go to call 911 or go to nearest emergency. Next, during medication preparation, a pharmacy technician accidentally contaminates sterile product. What is the most appropriate action of pharmacy technician to take? Discard the contaminated product and start over. Next, a pharmacy technician is handling medication recall for a lot of metformin due to contamination. What should pharmacy technician do? Remove the recall lot from the shelves and in only the lot number drugs of metformin are being recalled. So check the lot number and remove them and separate from other lots and label them. And also follow the instructions of recall. You don't call the patient. A prescription for atorvastatin is filled with the incorrect quantity, 90 tablets instead of 30. What should the pharmacist technician do upon finding out these errors? Correct the quantity to 30 and let pharmacists know about it. Next, a prescription indicates a higher than normal dose of hydrocodone, 20 milligram every 4 to 6 hours, and 200 tablet. Looks like a big number. And also, hydrocodone is taken every 12 hours, not every 4 to 6 hours. So, what would you do in this situation? Consult the pharmacist about the normal dose, abnormal dose, and alert the pharmacist about it. So, drug with the abuse potential, knowledge of controlled substances regulations are important. There are Schedule 2 drugs, most of them, and also prescription require verification for controlled drugs, check for authenticity and signs of forgeries, and also secure storage of these substances. Next, a prescription is filled for John Smith, but the medication bag is labeled for Jane Smith. So John and Jane, they are not same. So what should pharmacy technician do upon noticing this error? Correct it. Correct the label to John Smith and also Jane Smith. Next, a prescription for hydrocodone 10 milligram with SIG 10 milligram twice a day, 10 days, repeat 3. What's the problem here? Hydrocodone is Schedule 2 narcotic. Repeats are not allowed and notified to the prescriber. There, in the types of errors, some errors also can be regulatory errors, such as DEA regulations or state federal regulations errors. Next, a pharmacy technician is responsible for maintaining a clean, organized workspace. How often should countertops in the pharmacy be cleaned and disinfected? Daily at the end of each shift is a better one. Next, according to ISMP, which of these is the wrong abbreviation? Hydra and hydroxyzine. Um, Hydra and HYD are same. You don't capitalize them. According to ISMP, which may cause the least error? I mean, some of them has dangerous abbreviations in it. Some of them not. B is least likely because there is no dangerous abbreviation in it. Next, a patient with chronic pain was prescribed 10 milligram morphine to be taken twice daily, but prescription mistakenly transcribed 100 milligram. So instead of 10, mistakenly enter 100. So it is happened because of leading zero. So how do we prevent these leading zero problems? Never use trailing zeros after decimal point. So avoid trailing zeros here after decimal point. That can be result into errors 20. So therefore avoid that trailing zeros. Next, a doctor handwrites 0.5 milligram clonazepam. Patient was given 5 milligram. What is the most important, most appropriate reason for the error? Next decimal point, missing zero, trailing zero. Next, a patient reports an unusual dangerous side effect from medication. Pharmacists report FDA MedWatch. This referred as, what do you call this process? Adverse drug reaction reporting, ADR. In short, also known as ADR, which is generally done to the MedWatch program of the FDA. Next, LASA drugs, Tallman or mixed case letters contain drug names paired with recommended bolded upper-size cutter. What is the purpose of this? Just to draw attention to the dissimilarities in the look-alike drug names. Next, failure modes and effect analysis. FMEA is what? To predict the future error. Failure modes and effect analysis is systematic method for evaluating process to identify how might file assessing the future errors that can occur. It is for future, which is opposite of root cause analysis. Root cause analysis is done after error this happened. This will be done before even error happened. All right, next and last question. This is a bonus question of 50 and 51. A prescription for prednisone was mistaken with prednisolone. What is the Tallman letter? Which Tallman letter is correct for prednisone and prednisolone? Son and solone. This is the error. All right, with this information, thank you for watching. Stay tuned for more videos and subscribe Pharmacy Prep channel. Thank you again.